Hi folks, Dr. Beyer here again. Today we're going to go over reason number 9 why your thyroid is low and your doctor is not able to figure it out, and you're taking hormone, thyroid replacement hormone, and you're all over the place and you're still gaining weight and you're tired, you're losing your hair and your gut's not working, you're depressed, and you have to sleep all the time, on and on and on and on. I hear it every day in my clinic, so I'm trying to get the word out. Reason number 9 why your thyroid is low is a condition known as thyroid resistance. What I mean by that is your levels are good and your doctor's saying, I don't know why you're feeling the way you are because your levels are good, but here's the thing. You're not able, the thyroid hormone is not getting into the cells where it needs to do its job. That's called thyroid resistance. One of the reasons for that, and I see it all the time in my clinic, is because you have elevated cytokines. Now, what the heck are cytokines? Cytokines are proteins that are messengers in your immune system. And cytokines are going to be elevated in all infections, but the type of infections that we see that you may have and you don't know about it and your doctor doesn't know about it are hidden viruses, things like Epstein-Barr virus or cytomegalovirus or even herpes simplex virus, whether it's oral or genital. These will cause elevated cytokines and they will block your T3, which is the active form of your thyroid, from getting into the cells. We see this all the time, hidden gut infections. There's a lot of stool tests out there that are really poor quality. So if you had a stool test and the doctor says you don't have an infection, then it could be a false negative. Or if you haven't had a stool test and you got digestive complaints, you need to get it done. So hidden gut infections like H. pylori or parasitic infections or candida, yeast overgrowths, this will cause elevated cytokines, which are the messengers in the immune system, which will block your T3 from getting into your cells and doing what it's got to do. Lyme disease, we had a case of this just this week, which is something that a lot of doctors don't understand, and sometimes given the history we'll have to check for that. Elevated cytokines block T3 from getting into your cells. Folks, if you're suffering from low thyroid, you suspect you are, or you know you are, and you're not getting the results from just taking Synthroid or levothyroxine, I'm going to implore you to come to my next workshop on thyroid disorders and why you have them. It's just full of information that you're going to get that could possibly totally change your life, as it has for many of my patients. It's going to be held in my clinic in Tinley Park next Wednesday.